Well, healthy eating could soon be a little easier for some families in D.C. D.C.'s Department of Health is teaming up with Instacart and Martha's Table for a new program giving about 1,000 families in wards 7 and 8 a chance to get fresh, nutritious food. And joining me now is Dr. Ayanna Bennett, the Director of Health at the D.C. Department of Health. It's always good to talk to you. And I just want to start with, what inspired you to launch this and what difference do you hope that it brings for families in wards 7 and 8?
Well, we know a lot of what separates the health of our residents in the district is opportunity. People don't necessarily have the opportunity to get the kind of healthy foods and healthy activity that they need to get in order to keep chronic disease down and other health threats. So we want to be sure that we eliminate all barriers that we can and give people the maximum opportunity to be healthy. And this is a program that really, really does that.
Right. And Dr. Bennett, I feel like this conversation has been an ongoing one for quite some time. So it's really good to see a program like this being launched. How does it make it easier for families to bring that fresh, healthy, nutritious food into their homes?
Well, we know that people don't always get the fruits and vegetables they need, and that part of what causes that is that grocery stores just aren't as accessible to everyone across the city. If you live in Ward 7 and 8, the chances are you live more than a mile away from a grocery store, and also the chances are higher that you don't have your own form of transportation. So that just makes the logistics of getting to a grocery store much more difficult, and that leads people to get faster, more convenient options, which tend not to be as nutritious. And so this program allows people to avoid that transportation issue altogether and order their groceries to be delivered at their home.
And how does improving the access to the fresh foods translate to better long-term health for families in these communities?
Well, we know that what you eat, the cholesterol, the fat, the sugars, all of those things in processed foods that make them so convenient, but also make them less healthy, are things that we want people to try to stay away from as much as they can. But that is the kind of food that's accessible if you walk to a corner store or you go to a convenience store. So we're looking for people to have that full array of choice, to have those fruits and vegetables available to them the way they are to most residents when they go to a grocery store. And so this will let residents who are eligible for supplemental nutrition program, and the Supplemental Nutrition Assistance Program, or SNAP, is used by 140,000 residents. There are even more of them who are eligible for the program, and 1,000 of those folks who are doing nutrition classes and really working at this issue are going to now be able to use that knowledge to get groceries brought to their homes that help them live out those lessons they're learning.
Okay, so how can families sign up for this?
We are working with our community partners. So these are people who are already enrolled in classes and they're being offered that opportunity from the YMCA, Sorogi, UDC, and Martha's Table are all recruiting families starting this week. And we hope that we will reach that 1,000 soon and they can really start using this program. And we are going to aggressively evaluate to see if this does in fact help people eat better and have more access to food.
All right, Dr. Ayanna Bennett, thank you so much for your time, Director of Health at the D.C. Department of Health. We appreciate everything that you're doing for the community.
Well, thank you for having me. It's an important message.
Yes, indeed. Thank you.